Good evening, everyone. It's County Executive Marc Molinaro. Thanks for joining us again. This is both our Facebook Live town hall matched up with a telephone town hall. And so we're calling thousands of residents across Dutchess County, actually dozens of thousands of residents across Dutchess County, invited to participate in this telephone town hall. Tonight, if you're on the telephone and have a question for us, please dial 0. Again, you'll be asked, when you dial 0, you'll be asked to record your question, but don't worry when it's your turn to ask that question. If we are able to get to you, you'll be live on the telephone town hall with us. Just as a reminder, as we're calling residents across Dutchess, when you've asked your question, they do then mute the line so that we can get to the answer and try to move through as many questions as is possible. So again, dial 0. If you'd like to ask a question. If you're on Facebook following us this evening, please just type your question in the comment section below the live feed, and we'll get to as many as we can. So tonight I'd like to get you updated on some of the data, which is very promising here in Dutchess. We recognize and, quite frankly, are alarmed by some of the data and the case increases across this country. We'll talk a little bit about some of the actions, of course, the state has taken that relate to other states in the country. But the good news is here in the Mid-Hudson region, we have sustained a good amount of ongoing testing, so we're able to monitor cases, monitor those who may have transacted or contracted the disease. At the same time, we have seen a steady, a basic decline and sort of plateau of cases. So jumping right in, as of today, Dutchess County has, with our partners in healthcare, conducted 80,236 tests. And now the testing capacity is important. It is a weakness that was identified nationwide and still is. Access to testing is still a bit of a weakness in our response to the pandemic and managing the disease. But here in the Hudson Valley and throughout New York State, there has been greater access, 80,236 tests conducted, with 4,380 individual positive cases identified over the course of the pandemic these last several months. Currently, the Dutchess County Department of Behavioral and Community Health is monitoring 222 active cases, which has been, it's a little bit higher than about a week ago. We were in just under 200 or about 200, but 222 active cases. 5 individuals only are hospitalized in Dutchess, and sadly 153 individuals have succumbed to the disease. Now, I'd offer at least one bit of good information as you'll monitor our data dashboard, which you can find at dutchessny.gov. Yesterday recorded no new cases of COVID-19. Now that is just a reflection of the test results on that day. It is clear that we still are seeing the transmission of the disease, and we are seeing basically single-digit increases each day, although as you might remember a week ago, we did see a 38 to 50 case increase. As we referenced, about a third of those cases were false positives. You should be very happy to know that we identified them very quickly. We were able to respond very quickly with our nursing home group. It was a series of false positives at an area nursing home. Again, false positives identified. And then another third of those cases were very specific to inmates at New York State prisons. And I know there were some questions about testing at New York State prisons, but that was the reason for about a third of those cases. And then the balance, again, a little bit higher than the single digits, but the balance under 20 positive cases. So that likely is a reflection of some of the activities that occurred over the last 2 to 3 weeks, graduations, community events, and 4th of July celebrations. But the good news is that they haven't translated into an increase in hospitalization, and thankfully no new deaths in the immediate past. We're also obviously monitoring our data not only for our own purposes, meaning managing the transmission of the disease, and of course trying to respond to cases and individuals who may have contracted the disease, but also the rate of transmission. which in a moment I'll have one of the guests on today's town hall talk a little bit about. But the state identifies what they call a transmission or an infection rate. Is not actually an infection rate. It's more of a percentage of those tested who test positive. That's not a true infection rate, but it is the rate that the state uses to monitor transmission. It's also the rate that the state uses to determine which states fall within the travel advisory, and it also is the rate that the state uses, again, based on a 7-day rolling average to determine school reopening and potentially school closing should we end up in that situation. But currently the infection rate, if you will, for the Mid-Hudson region is 1%, and we'll continue to monitor and share that information. You'll find it on the data dashboard. If it's not there yet, it will be there in a chart form. You'll be able to see, it is there. You'll see it as the percentage positive on the data dashboard, and you'll be able to monitor that as well. We think that'll be useful information as we have to monitor for school reopening and closing. If you have a question and you're on the telephone line, please press 0. We've called thousands of your neighbors. You're on with County Executive Marc Molinaro and a couple guests that I'll introduce in a moment. If you received a call or you called in, dial 0 on your phone. You'll be asked to record a question. We'll try to get to as many as we can. Tonight we're joined, as we have been at every one of these telephone town hall meetings, by Dr. Anil Waithian. Dr. Waithian not only is Commissioner of the Department of Behavioral and Community Health, he is an infectious disease doctor and has provided a great deal of not only leadership but also insight to a number of organizations locally, and has provided some assistance on these calls with Congress members Sean Patrick Maloney and Antonio Delgado. So we're grateful, Dr. Waithian. Dr. Waithian has also been on the radio a few times, and I know he enjoys that very much, I said with some degree of sarcasm. But tonight we're also joined by Allie Smith. Allie is Dutchess County's epidemiologist, and we'll ask Allie a few questions in a moment and talk a little bit about what her role is at the Department of Behavioral and Community Health. And she's here both for the Facebook Live video and on the phone. And joining us also on the phone is Assistant County Executive for Economic Development, Ron Hicks. And Ron has been steering our efforts to support and inform community businesses throughout Dutchess. So again, if you have a question, dial 0. This is our Facebook Live and telephone town hall. We are now doing our telephone town hall sessions once a month. However, we will be live on Facebook again next Wednesday, July 29th at 3 p.m. And we'll be back live with you for a telephone town hall on the 26th of August. A lot of dates. We'll get to them in a moment. Let's roll through some data. And if you have a question, dial 0 or write them in the feed, in the comment section below the feed. The data suggests we're making all of the right choices. We need people to continue to be vigilant. We've talked about this before. It is critically important we continue to engage in that physical distancing. I hate the term social distancing, but physical distancing. Remember, there are a lot of businesses now that are reopened. A lot more activity has returned to some semblance of normal. As you're out and about, we want you to keep it small, meaning if you're going out for dinner, we want you to do that in small groups, preferably family or individuals you've interacted with more regularly. But if you are out and around, please honor and respect the physical distancing. And I'm talking to you, the person at the grocery store who wants to zoom in and out and sort of weave between the aisles. A lot of businesses are making and taking the steps necessary to be safe, and we'd ask you to honor that. Also, again, basic personal hygiene. My wife laughs that we have to remind ourselves to wash our hands, but this is what we want to remind in all cases. Personal hygiene, simple soap. I know we talked about this early on, but simple hand soap or dish soap, and it's that friction that you would use that makes all the difference. Of course, as a backup, you can use any one of these hand sanitizers. I think we have them just about everywhere these days. And please wear a mask. For the love of all things, wear a mask. I was very grateful. We received a package of these. These are actually donated by the New York Mets. This will be the only time that I will ever be in a Major League Baseball uniform. But my mask is from the New York Mets, and I wear mine. And please wear yours as well, out of respect. Now, if you have an underlying illness, we've discussed this, or a disability or some reason that you medically can't tolerate the use of a mask, it doesn't mean you get to go storming into a business. It doesn't mean you get to go down the grocery store aisle and throw things in your cart. And it doesn't mean that you should take out your frustration with the people who work in those businesses or organizations. It is, however, their responsibility to accommodate you alternatively. And a reasonable accommodation could very well be curbside pickup or delivery. But please be respectful. This is the time to show our best, not engage in our worst. And I just really encourage it. Very important. We always get hit on these questions, so let me jump right in very quickly. No updates yet on gyms, theaters, or Splashdown. We have asked this. Today, again, we meet daily with representatives from the governor's office and state government. They are the ones empowered to make these decisions under the law as adopted by the state legislature. They have not provided guidance for gyms, theaters, or Splashdown. Still nothing new on indoor wedding venues. And as it relates to unemployment insurance, the federal government, Congress, has to make a determination and is meeting this week and next to hopefully come to a conclusion on whether or not they're extending the unemployment benefit. We are in the midst of phase 4, and we'll discuss a little bit about that this evening. But since we met last, the State Liquor Authority, the New York State Liquor Authority, has issued guidance for this food with alcohol service requirement. I will say this up front. Ron may not want me to say this, but it is a dumb expectation. It is a silly means to a very important ends. And I say that respectfully. The end is important. We need to limit the size of social gatherings. We need to limit the size of groups at bars and restaurants. The state has decided that in their estimation, one of the ways to do that is to require you to buy food while you eat. We think the most effective way to get you to pay attention to doing that is by saying, do that. At the end of the day, limit the kind of groupings. We need businesses to comply, and we need you to honor that. And I will tell you that there are actions that will be taken against, in particular, bars or restaurants that are not following those basic expectations. We know that in states across America where we've seen growth in the transmission of the disease, it is easily able to link back to individual actions that are generally in close proximity within 4 walls, that you're sort of relaxed and casual in a bar setting, you're laughing, you're joking, and quite frankly, you're spitting. And ultimately that causes a concern, and we've seen the transmission of the disease. We can point back to those instances. So in this county, follow the expectation, but the expectation isn't that while the rule is you eat while you drink, the expectation isn't about eating. It's about limiting the gatherings, and I think that is a more effective message. So please follow it. I can tell you there are 1 or 2 businesses in the county that we've had to reach out to very aggressively and explain that you must honor that expectation, and we're going to continue to do that. So Wendy asks, can you clarify the rules for serving alcohol at a restaurant with outdoor dining? Ron Hicks, Assistant County Executive for Economic Development, do you want to talk through what the expectation is currently regarding this purchase of food and outdoor dining?
Our understanding is it's the same as indoor. So if you are outdoor dining, before you can place an order for an alcoholic drink, you actually have to order a food item. So it's the same.
So the expectation again, and I say this and because I think that the goal is more important and is the most important thing. And frankly, I think we'd be better off saying to businesses, if you can't comply with the expectation that you limit the big groupings of people, then we just can't allow you to continue to function. We need to follow that expectation. But the rule as put forward by the state is that the restaurant must provide you the opportunity to purchase food which is substantial and generally matches what they've been permitted to serve. Is that basically right, Ron?
That's correct.
Yeah, and you can hear Ron's exhaustion in that. I mean, it is, try to honor it. But what is most important is limit those gatherings. And if you're going out to dinner, it's just a couple friends, it's maybe your family. Limit those numbers. If you're headed out to a bar, remember the expectation is that we sort of limit those social gatherings. And again, because that is an environment where we know the disease can be transmitted. Let's jump to Linda from East Fishkill, who's on the phone. Linda from East Fishkill had a question regarding people not wearing masks. Linda, are you there? Linda?
Sorry, I was on mute. Yeah. I mean, I find that there are some people who are not wearing them over their noses, not wearing them at all. When I've been in stores, I've been uncomfortable. I've spoken to the owners, and they just sort of shrug like, it's suggested but not mandatory. And you just don't want to confront people. But there are so many people who are not following the mask request.
So first, you're right. I don't think it makes sense for individuals to confront one another, and I say this to both sides of this argument. If you're concerned about people not wearing a mask, I mean, certainly if it's a neighbor or if it's a community business that you could always ask. But I don't think it makes sense to confront people. The other side of the argument is, quite frankly, if people are wearing or not wearing masks, it's not polite, nor is it appropriate to go out taking pictures of people. We've seen it, videoing folks. Let's not go down that direction. You are correct to mention to the business owner what the expectation is. Ron, one of the questions that we got from Susan is, and this ties into this question, so let's answer it, is there a mandated mask order in New York? There is no expectation that in public settings, sidewalks, parks, streets, there is no expectation that you wear a face covering if you can engage in the physical distancing. However, there is an order that in order to access a business, the business is to mandate mask use. Do you want to explain that, or Ron?
I'd love to explain. I mean, it's very hard to enforce, but it is something that the governor mandated recently, and that is, originally he had said that the businesses have the right to refuse service to anybody who enters without a mask, and he has upped that and now has said that they must refuse entry. It makes it very difficult because you need to almost employ additional people in order to police that. I know we do a lot of sampling, and we have found very good compliance, but there are also areas where some people walk in. I've seen it in the Home Depot, and staff will run up to them and provide them with a mask. There are people who are not able to wear a mask for a medical condition, and those people are exempt. And at the same time, the executive order protects them from you asking or anyone asking them what their condition is or to prove it. So that creates a bit of a problem. And some of our sampling has also noticed that if people are social distancing inside the store, the employees, they sometimes don't have the mask because if they're working long shifts, it can become very difficult to tolerate. But they must put them on when people enter, and then of course, in confronting any customers, they must be wearing them. But if you do see egregious violations, you can go onto our dutchessny.gov and go under COVID, and you can submit a complaint so that we can investigate it. But we have seen pretty good compliance countywide.
And it's translating in our data. So at the very least, we're sort of monitoring and not seeing an uptick, if you will, in cases. That doesn't mean that can't happen. It just means that at the moment things people do seem to be relatively considerate. That said, again, the expectation is that if you're in a business or you're not able publicly to engage in that physical distancing, you should wear a face covering. And I'll say again, as Ron said, if you have some underlying illness or disability, you're not obligated to, and you're not obligated to express what that is. However, please understand that the business does have the right to deny you access, but rather create a reasonable alternative to providing you service. It's the basic language of the Americans with Disability Act, a reasonable accommodation. That accommodation is not that you just get to walk in past the staff. So please be respectful of that. If you have a concern regarding areas where there is just people not not wearing masks and following the expectation, you can register your complaint through dutchessny.gov. If you're going places where you feel that it's being enforced inappropriately, you can register your complaint there as well. And we try to navigate through these complaints. I will tell you, it is not our desire to begin with a heavy hand. We try to discuss the issue. We try to mitigate the issue. We try to minimize. Just understand that no matter what we do, we're never going to have 100% either, right? There's never going to be 100% compliance. There's never going to be sort of this acceptance one way or another. We try to get people to follow the rule. We want you to be considerate of it. And again, I think it is important that we, at every opportunity, when we can, we should be wearing the face covering. It's patriotic as well. So we want you to do that. So let's continue along quickly with some additional information. Want to let you know that 10 states have been added to the travel advisory. Again, New York, New Jersey, and Connecticut have issued these travel advisories. We did get a question from Deb. What does a family have to do when they return from one of the 31 banned states? Well, first, I would offer it's probably safest to vacation in New York at this point than outside. But we're joined today by Dr. Anil Waithian. Dr. Waithian is our Commissioner of the Department of Behavioral and Community Health, our health department. Dr. Waithian, what is the expectation under the travel advisory? So there are now 10 new states. Let me just add them. Alaska, Delaware, Indiana, Maryland, Missouri, Montana, Nebraska, North Dakota, Washington, and Virginia. Now, I'm very upset that Virginia has made it to the list because I won't be able to visit my in-laws until that. My family's from Virginia. My wife's family's from Virginia, but they've been added. Those are now 31 separate states. Dr. Waithian, the expectation on the travel advisory, if someone goes for, again, a period of time, it's not that you're just driving through. It's that you've spent basically 24 hours in that location. And then you're coming home, or you're from those locations coming here. What is the expectation?
So, Mark, those states that have been identified have rates of community transmission that are of significant magnitude that would give any traveler cause for concern. So anyone traveling and staying for an extended period of time in these states has a potential of being exposed. So the expectation is upon return to New York that they self-quarantine for 14 days. And so during those 14 days, there is a mechanism through the New York State Department of Health of registering yourself, and what that also allows the state to do is to reach out to you and to provide education and other guidance. And during those 14 days is to monitor for symptoms or any reason why testing should be also initiated.
So we're asking that you follow that expectation. Remember, the state does suggest that if you're traveling and you come back to New York, or you're from and you travel to New York, you do have to fill out that travel form. There is a fine up to $2,000 for not filling that form. That is between you and the state. That said, failure to comply with the quarantine expectation could result in as much as a $10,000 per incident, meaning per day, fine. So just be aware of that. We're asking people to comply. Certainly, we hope for voluntary compliance. I know we had a couple of questions that have come in. I want to try to race through a few Facebook questions. If you have a question on the telephone line, dial 0. We'll try to get to you as well. Ron, a number of people are asking about dance studios, and this is probably a good time to explain low risk, what I'll say, recreation or athletics or what have you in a studio setting. Do you want to explain what that expectation is? And the question was specifically updates on dance studios.
Yeah, so we've been answering this question very specifically with vendors because so many of these, what we call studios, operate differently. You know, whether it's ballet, it's group, it's individual. We've gone back and forth with the state for more than a month now after they promised additional guidance. We have not seen it. The original guidance was offered on June 26th, It is available online if you Google Sports and Recreation Guidance, it's interim guidance from the state. And what they do is they identify 3 different categories of low, medium, and high risk activities. Dance is categorized in the high risk activities, but all of these we understand were permitted for outdoors. And there was a question as to whether or not they were permitted indoors. There's conflicting information in the guidance. And because we have asked so many times and not received an answer, we got our own legal opinion internally, and we have decided that we would not be enforcing those who operate indoors so long as they adhere very strictly to that guidance. So if you are planning on going, if you have a studio, and you have a dance studio, you must strictly adhere to that guidance, including the template that you have to create and the attestation. But you can do that indoors. Again, you have to adhere strictly to the guidance.
So if they're watching now and you have a question specific to your business, they can reach out to us, visit dutchessny.gov. Or email or contact us directly. We'll give you what we know the guidance to be, but the expectation is that studios with limited activities can function, correct, but they need to meet those very specific precautions, including the safety plan and the attestation that you have a safety plan. Is that right, Ron?
Yes, and that goes for all the low, medium, and high-risk activities, sports and recreation activities. Obviously, there's no contact in any of these. There can't be any contact.
Right.
So there are martial arts studios where they are providing instruction. There is no contact. So as long as you adhere to those guidelines, until the governor clarifies the guidance or Empire State Development clarifies the guidance or specifically says that this can't be done, it is permitted.
Okay.
And thanks.
No, that works. So, Dr. Wythian, we have a guest today, Allie Smith. Allie is the county's epidemiologist, and I have to tell you a funny story. I'm hopeful that the woman is watching, but there's a woman in Millbrook who criticized my town halls, suggested that that I'm not always as informative as I need to be, and wondered about all the people who are doing all the real work, and why is it just the politician in front of the camera? Believe me, Allie was so thrilled that I asked her to appear on Facebook Live. But I think it's important. And Dr. Wythian, first, before we jump to Allie, talk a little bit about and briefly, what you have a team of people at Behavioral and Community Health. What have they been doing these last 4 months? And then there's a specific question as you answer that one. About contact tracers. How many do we have? Do we need any more? And then why don't you introduce Allie?
Thank you, Marc. So handling a pandemic requires a lot of people that work together as a team. So not only in terms of dealing with sort of containment efforts of identifying people who may be positive and may be harboring the disease, and discovering all those people within their social circle that may have been exposed and making sure those people don't go on to develop disease and potentially continue to pass on within the community. So a lot of that is not only related to gathering data, but it's also very labor intensive as it relates to disease investigators who reach out either through phone calls or other means to connect with cases and contact and not only educate them, but also to make sure we put in place measures to terminate the potential, transmission cycle that may be occurring in the community. And so it's the public health effort that has been ongoing since March that has turned the tide in not only in Dutchess, but in greater New York State. And it's individuals such as my colleague, Allie Smith, who's been on the front line. And I will tell you that Allie has worked almost 7 days a week, at night, She sent out emails at like 2, 3 in the morning. So I know that it's been a Herculean effort by all my team, but as it relates to data and tracking numbers and how the pandemic is evolving and what the arc is within Dutchess County, Allie and her team has been at the forefront. So Allie, take it away.
Allie, what is an epidemiologist?
An epidemiologist is someone who has trouble with the mute button. An epidemiologist is, in the quick sense of the word, is someone who studies disease and how it moves through a population. So the bulk of an epidemiologist's work is identifying patterns.
Disease spreads, who it spreads to, where it spreads in the community, things like that. So hopefully we can stop it and put mitigation efforts in place before others get sick.
Review.
With my title, just one. It's me. But we do have others doing similar work. Our coordinator of communicable disease handles a lot of epidemiological work, as well as our public health advisors, disease investigators. So it's not just me. There's a lot of us doing similar work. I just happen to have the lofty title.
Well, and you inform them. I mean, the key here is that we have a very big team at Behavioral and Community Health, and you all have done an enormous amount of work over these last few months. And even though I shouldn't say even those in other divisions within the department have been assigned tasks of responding to the pandemic. Including, by the way, a good number of volunteers who participate as contact tracers and employees who act as contact tracers. How many contact tracers do we have on the books, and sort of how many are engaged at the moment?
So, alrighty. So there's two kind of arms to full contact initiative. So there's case investigator, and then receive a positive result.
Informed of that case, our case investigators call that person, gather information, and elicit the contacts that may have been exposed. From there, the contact tracers then contact those contacts and help put in place quarantines and answer questions and provide education to them. So there's two kind of sections to this whole initiative. For contact tracers, we have about 50 Medical Reserve Corps volunteers who are working actively 7 days a week to contact those people who are exposed. And we're also utilizing the New York State Department of Health.
Hired contact tracers as well. I don't know how many they have. They kind of work in shifts. We also have a large number of community volunteers on standby and ready to assist if we have any surge needs as well.
I think between volunteers, staff, and including those who are just really on standby, we have I think close to 300 or in the 300 neighborhood. But you're correct. Actively, there's a smaller pool, and so they're actively working. Kelly asked on Facebook, will a contact tracer leave a voicemail when they call? It's a good question. A lot of folks don't. We're telling them that they should see on their cell phone something that says like New York State contact tracing, but that may not always be the case. So does a contact tracer leave a voicemail?
Usually they do if there's the ability to
voicemail. Obviously, if the phone voicemail box is full, they won't be able to leave one. Usually they leave a voicemail if they are a county tracer. They are leaving a voicemail usually with our call center number just to let whoever they're calling know that they need to get in touch. They can call this number. Usually we try a couple times or a couple days.
The state New York State tracers, I don't believe leave messages. They do not have a callback number set up at this time. So that should be developed shortly, we hope.
We hope. So I'm going to do this. There are a number of people on the phone. What I'd like to do is get through a handful of questions from the phone line. For those of you who have, and I have a pile of questions from Facebook, I'm going to get through as many as I can. The Facebook Live component will likely go past 6:30. However, the telephone line system we have until 6:30. So why don't we go to John. John had a question about testing and results. John, are you on the line with us?
Yes, I am.
Go ahead. Go ahead and ask your question if you'd like.
The question was, is there any regulation as to how long it should take from the time that you get tested until you get an answer?
It's a good question, and everyone who's been tested has experienced something different. Anil, expectation from time testing to when they should receive a result, and what frustrations have we experienced with lab results?
So that's an excellent question because, again, one of the things that we sort of ramped up significantly during the early stages of the pandemic response in New York was to improve our testing capability. But what is happening now is that thousands of tests are being done, and it is not just our county. And so large laboratories such as Quest and LabCorp are being inundated with tests, not only from New York and our counties, but also from other states. And so what is happening is quite a bit of variability in the time that it takes from the point a sample is drawn and to the point when results are available. And so the hospital systems are doing very well because they have access to rapid testing. But sometimes if a test is drawn in a pharmacy or in some groups where there is batching of samples, sometimes it takes quite a number of days before even the samples get to the lab. So that all adds to the variability in the time that it takes for results to come back. And what we are seeing is from a couple of days to well past 10 days. It's unfortunate, but this is what we're experiencing now.
Thank you. So yes, I mean, some are very quick and some not so quick. And I know that we've been pushing on both the labs and the state to be of some assistance in that regard. I mean, in order to appropriately respond, we need results quickly. I want to jump to Rita. Rita had a question regarding face shields, and I think it's a good question. Anil, I'll allow her to ask them, but I think it's basically, face shields versus masks versus et cetera, and perhaps talk a little bit about that. But go ahead, Rita, if you had a question.
Hi, yes, that's it exactly. I'm seeing more and more of the face shields, which for a lot of people seems to be a better way to breathe. Just wondering, is that appropriate? Is it an okay thing for us to be using in lieu of the mask?
Okay, absolutely. It's a good question. Anil or Allie, whoever wants to take that question, I'm happy to pass off to you.
I'll take that question. A face shield is effective when what you're trying to do is prevent water or secretions, droplet secretions from hitting your mucous membrane, meaning your eyes, nose, and other vulnerable areas. But a face shield does not protect the people around you, meaning it does not prevent if you are symptomatic or asymptomatic and potentially putting the virus into the air. The face shield does a very poor job as compared to if you are wearing a mask that covers the nose and mouth.
So we have obviously we always tell folks physical distancing is the safest, and that's more than even 6 feet. I mean, if you don't have to come into contact with people, that's the safest. The face covering, traditional mask, again, it's sort of secondarily beneficial, and then the face shield is less so. But in certain environments, the face shield is likely of use. In particular, if I'm wearing a mask and I'm going to a business or something, the face shield could be useful, but it is not the most effective. Is that fair to say, Doctor?
That's a good assessment.
Okay, I try. I was criticized the other day for repeating the things I learn. I suggested that is, in fact, what we all do, I hope. So I've learned that from you, Doctor. I want to jump to another couple questions on the phone line. And again, if you've asked questions on Facebook, we are going to get to them. Even if it takes us past 6:30, we will get to them. I just want to get a few more from the telephone. We are getting a number of questions regarding breweries, wineries, and bars. Kathy from Stanford had a question regarding that. Kathy, go right ahead. Kathy, are you with us? Kathy? No.
Yeah.
Oh, yeah, go ahead. Go ahead and ask your question.
Oh, so my question is, what are the guidelines for the eating of food in places that serve alcohol? What is the kind of food that's considered appropriate? For example, are chips okay, or must it be a more substantial meal?
Well, I'll give you the correct answer, and then I'll give you our interpretation. Ron Hicks, why don't you give the correct answer and/or the interpretation of the correct answer? What are the new expectations for restaurants? Well, again, I mean, I just think it's better to say to people, listen, the end result here is we need smaller gatherings. We can't have group events, parties. You need to honor that. And I think it's much better to just be honest with people. You can't do that. If you do it, we're in a position where the disease will be transmitted more effectively, and we will be forced to shut things down again. That, I think, is a much more honest directive than to say, well, if you happen to be out and you're going to get a drink, you might as well eat too. But go ahead, Ron. Explain what the rule is.
The rule, as we understand it, is that each of them, there are many different liquor licenses out there, or licenses from the SLA. And it is specifically described within their license what food is permitted to be served. So they have to follow the license, the guidance with their original license as it relates to the food that they serve. So in other words, if it is a regular restaurant, they can't just put peanuts out and have someone eat peanuts. It has to be something from the menu that's already available. And they can also order, apparently, a dessert or something like that, and they can certainly share. But it must be more substantial than what has been described as the Cuomo chips.
There you go. So it does have to be something of substance. It should be in line with what is basically on the menu. What I would say to you is that if businesses are limiting the group gatherings in this county, that's what we're watching. It's more about the gatherings, and Ron will tell you there have been several businesses that pushed up against that limitation, and we reacted appropriately. And we're monitoring to make sure that they comply with that basic expectation. And that really is at the moment the expectation. Small gatherings, small groups, individuals, keep it small is really the better of all of the arguments. I want to go to, I think Richard had a question regarding school reopening on the telephone. Richard and school reopening plans. Go ahead.
Yes. Can you hear me?
I can, yes.
Hello?
Hello.
Okay. Everything that I've seen so far indicates that schools will open and close based on region. Given that Mid-Hudson Valley has multiple counties within its region, what is going to happen if certain counties become hot and others do not? For example, Putnam becomes a hot county, but Dutchess still looks within the criteria of 5 to 10%.
So, I mean, the short answer is that the state is functioning. We understand that reopening is based on region. We understand that their desire is closings or reclosing, if you will, would be based on region, but they have not said with absolute certainty that that's the case. So you could envision that if there were a concern in one county, that doesn't mean that every county school would close, but again, they want to try to function based on regions. That said, what I would offer you is we are benefited by being in this region in that our population is so large and our testing capacity is so much that getting above 5% in again this positivity rate is likely more difficult because of the amount of tests that would be conducted here in the Mid-Hudson region. And Allie or Dr. Wythian, do you want to talk a little bit? I mean, what does 5% infection rate mean, and what does 9% mean? Allie, I think your reference to us was that it's more of a positivity rate than than a true infection rate or true transmission rate. Do you want to explain that a little bit in a way that I can understand?
Sure. So the way the state is describing this method is really
that was turned positive. So in order for schools to reopen, the state has said that that number, that percentage has to be 5 or lower in order for schools to reopen. Schools will then close if it reaches 9% or higher. So meaning that 9% of all the tests done within a week or so, because they use a rolling average, that's when they would determine whether to close schools, if that many tests come back positive.
So it's unlikely. It's unlikely.
Sorry.
No, I was going to say, for instance, if Putnam County jumped to 5.5%, but all the other counties were in at 1.2, which is basically where we are today, as a blended 7-day rolling average, that won't likely have much effect on the region. It may determine that they decide that they have to close schools in Putnam. And of course, if they occur in Dutchess, they may make the decision that if you get to 9.5% in Dutchess, it's only Dutchess. But the fact that it's a 7-day rolling average among a population of millions, because of the size of our region, it's unlikely that a blip, and I say it respectfully, an increase in one county would necessarily impact all of the counties. Is that fair? Just mathematically?
Yeah. Yes. So the 7-day average is really great because it's good at kind of smoothing out the data, if you will. So little blips will not necessarily throw the entire region off course, but a large increase across the region or an actual significant substantial increase would cause us to reevaluate and then, probably rightly so, look into closing schools. You mentioned infection rate. An infection rate is usually a measure of how infectious the disease is. So, for instance, if one individual is sick with COVID, how many people are they going to spread it to? So there's a few different terms thrown around, but the way the state is interpreting this is the percent of tests that return positive.
So it's not actually an infection rate, but in fairness to them, there's only so many data points that you have access to make an educated decision. That's fair. If we were at 9.5% in transmission, that seems really high.
Yes. 1% positivity rate would take us back probably about a couple months, towards probably about April or so.
Yeah. So, again, if we're in that neighborhood, I think that you would want to be concerned that it would be more than just a single county. I mean, if a single county is at 10%, it is likely we all will be near that because of the proximity we have to one another. That's fair to think, Allie?
Mm-hmm. Yeah, I doubt it would be a singular incident that would cause one county to jump to 9% while the others are completely unaffected.
Right. And again, currently our transmission rate in the region is 1%. And in Dutchess, we've been hovering just under or just above. So some days 0.7, 8, and some days 1.2, 1.3. Let's jump to Elise. Elise is on the phone. She had a question regarding air filtration, etc. Elise, go ahead. Are you with us, Elise? Elise going once. Okay. No, Elise.
Here I am.
Oh, go ahead. Where were you? We've been waiting.
I was in the kitchen cooking up my meatballs.
Elise, if you're not sharing the meatballs with us, you don't get your question.
Oh.
Go ahead. No, I'm kidding. Go ahead. Ask your question.
I'm a member of the DAV, and I was invited to a breakfast Saturday at the 84 Diner to meet with other DAV members. And I don't feel comfortable. First of all, I don't know if the 84 Diner made any accommodations for people to eat outside, because I will not eat inside, because I don't know if they changed anything in terms of the air filtration there. That's number one. And number two, I don't know if they have outdoor seating. So I'm concerned about not being able to go.
Well, I will answer part of that question by saying, you can always just call ahead and check in, although I do feel the 84 Diner is doing outdoor dining. I think I saw pictures of outdoor dining, but you should call ahead. The other, though, is Ron Hicks. What is the limitation on both indoor dining and groups? For instance, just because a restaurant can function at 50%, the expectation is not that the 50% is all one group. What are those expectations, Ron?
Yeah, of course. This is where the guidance is so confusing because social gatherings are limited to 50 people. So any event, anything that's planned where people will come at the same time and go at the same time is restricted to 50 people. However, a restaurant where people tend to come and go at different times is limited to 50% of their total capacity. So while I don't know how many people intend to go to this indoors, but they would be limited as an event, limited to only under 50 people, and then it would certainly have to be 50% of the capacity of the restaurant. I do believe they have outdoor dining. I do not know if they have enough outdoor dining for your event. And as it relates to air filtration, I'll just add that I don't know that the restaurants, anybody outside of malls, were mandated to update their air filtration to the HEPA filtration and a certain MERV rating.
Thank you for that. And 84 Diner is doing outdoor dining, so you may want to ask the DAV if they're taking advantage of that and you're eating outdoors. So if you're on the phone and we don't get to your question, please feel free to follow us on. If you have access to Facebook, jump over to Facebook. We're going to stay live a little bit longer because I have about a half an inch of questions that I really feel like we need to get through. But dial 0 on the phone if you would like to have your question asked. We'll try to get to you. Let's run through as many of these Facebook questions as possible. Dr. V, if you get tested and have the antibodies, do you need to go through contact tracing? Allie or Anil?
No, you do not. The contact tracing case investigation, where someone from the Department of Health would be contacting you, is only applicable to those who test positive for the virus. So receiving a virus test, a PCR, an NC swab, any of those things, more of a diagnostic test would require follow-up by the state.
Got it. Ron Hicks, Kelly is asking, how do you know a business has done the proper paperwork to be open?
There are two things that we check for. Number one, that they have signed the affirmation and submitted to the state of New York, and we get a list of those affirmations on a daily basis. And the second, while they're supposed to be available for our inspection, I imagine you could ask a business if you go in to see their template. Each business that has been allowed to open is required to complete a template of how they respond to maintaining a safe and sanitary environment. And they're supposed to keep that on file for inspection. Again, I think that's for official purposes only, but I see no reason why you couldn't ask to see it to make sure that they have done that.
Thanks. Joanne is asking, she has asthma. Wearing a mask causes her to have asthma attacks. What are any options for her? So I'll jump to say, number one, again, if you have an underlying illness that precludes wearing a mask, you should contact the business ahead of time. They are required to make a reasonable accommodation. So again, it's one of the reasons that like grocery stores, you might do curbside. Many businesses might do curbside or online options. That is basically it, though, Ron, right? The expectation at the moment is that you can be denied service without a mask. It doesn't mean that without one you just get to walk in, but rather some reasonable accommodation is made for you. Is that basically the expectation?
That's my understanding.
So, again, if you have a concern, you should call ahead and find out what reasonable accommodation they're making for an individual who can't tolerate wearing a face covering. Naomi asks, what can we do if a building owner, manager isn't mandating masks inside their building? Are masks mandated inside of a multifamily dwelling if there's social distancing? Ron?
A multifamily dwelling, I do. If it is a commercial property, it is my understanding that in and out those hallways, they're supposed to be wearing it. But if it is not a commercial property, it's considered a private property, and it's just like your home. And if I could just add to that previous question, you did mention it's a good idea to call ahead. But it's very helpful to just let somebody at the store know that you have that condition and should expect them, because that way you don't have to go around looking and getting the bad looks from everybody. And they'll expect you and hopefully be able to perhaps even get groceries for you and get you on your way. Hopefully an establishment would do that for you. So
Terrific.
Just an extra thought.
Ron, I know you'll appreciate this, but Charlie North says you're doing a fine job.
Doc, he's great. I love Charlie. Hi, Charlie North.
Hi, Charlie North. Susan asks, how come dentists are at risk? Dentists can operate basically, but facial businesses can't. Ron, do you want to talk about facial businesses, makeup artists? We've had a couple of those questions. We've been trying to get direction. We think it's unfair in particular that the film and movie industry can function with makeup artists, but makeup artists can't function currently under the guidance.
Yeah, that is the nonsensical part of it. Certain medical procedures are required, like doctors, dentists, and et cetera, are essential, but makeup is not considered essential, and and they have to remove their mask to have that or piercings or anything else done, any cosmetic work. But as you said, the film industry is permitting it. We did ask the state well over a week ago to explain the difference and to permit individuals, particularly in a one-on-one environment, because we actually think that a one-on-one environment in a salon is safer than being on a movie set or in a theater where there is multiple people and there are other people who are maintaining social distancing and not wearing a mask or just interacting. So we think it's safer, and we've made that case, and we're waiting for them to respond.
Appreciate that. So we're going to run through a few more Facebook questions. Before I do that, I want to mention that Dutchess Public Transit fares will be reinstated on August the 3rd. We've been operating without any charging of fares, but they'll begin operating with fares on August the 3rd. The Beacon Free Loop remains still free and open and available to you. The Beacon Loop, beautiful little bus. Want to remind folks that to look out for that schedule, and that again, effective August the 3rd, Dutchess Transit will begin operating again with fares. I know Gina had a question. Gina, you're on the line. I'm just going to answer your question. Your son has a disability, and regarding masks, again, if you have a developmental disability or some underlying disability or ailment that precludes you from wearing a mask, you're not required to wear that mask. But again, you want to be respectful of the physical distancing, and if you need to go to a business or facility where a mask is expected, you should call ahead, explain the circumstance, and have an individual provide you that assistance. So I hope that answers your question. I want to jump just to a couple bullets more of information. If you're a senior citizen in Dutchess County, our Office for the Aging drive-through picnics begin next begin Tuesday in Pleasant Valley. So we're doing our drive-through picnics this year. Office for the Aging scheduled those. Again, Tuesday in Pleasant Valley, Thursday in Beacon. Now we're buying all of our meals from local delis throughout the county, so we're supporting our local businesses. And the full schedule is available at dutchessny.gov. I want to mention, as you likely know, we made an announcement this week with the resignation and sort of retirement, if you will, of Marc Coviello as Director of Veteran Services. We are thrilled to welcome Adam Roach. I've appointed Adam to serve as the Director of Veterans Services. The county legislature in August will have to confirm him by a vote, and if you support Adam in the work that he's doing, I encourage you to reach out to the Dutchess County Legislature and extend your support if you feel comfortable doing that. Adam is an Our Lady of Lourdes graduate. He is a veteran of the United States Marines, deployed both in Afghanistan and Iraq, and has been managing and running the Vet to Vet program through Mental Health America. He'll begin this August. I think he's a great guy. I mean, truly one of the nicest, I think, individuals you'll ever meet. Has created a great network, and we look forward to Adam joining us here in county government. Another great, I think, representative to serve veterans across our community. Let's run through a handful of additional questions. Karen is asking where there is free testing. Dr. Wythian, testing is available through your physician, but where else could one access testing, both free and otherwise?
Marc?
Yes.
If people access our county website, they're able to get a listing of sites where they can get tested. At this point, I think the vast majority of standalone testing sites have wind down. So private providers, pharmacies are available for testing, and I believe that Rite Aid in Poughkeepsie was free. I will have to make sure that situation is still the case. But testing is actually widely available, mainly through private providers and the provider community.
And you can visit dutchessny.gov for some more testing information. So I want to thank those of you who've been on the phone line. We are going to continue now the conversation for a little while longer on Facebook. So if you have access to social media, please jump over to Facebook. We're going to go a little bit longer. There are a lot of telephone town halls that occur, so we are able to rent the technology for an hour. So Jeff is going to move on, but who we've been very grateful. Jeff is from Texas. He's been with us now for I don't know however many of these town hall meetings, and he deserves a shout out. But we're going to leave the phone line open for Ron and Dr. Wythian. If you're on the line and been following us, jump to Facebook, and we will continue to run our town hall through Facebook. Patricia, can schools make staff sign a hold harmless waiver before they return to work? That's a fine question. I don't know that that's something they can do. Is there such a thing? Ron or Anil, is there a hold harmless clause that they can require to be forced to sign or required to sign?
Marc, I don't have any information on that.
Yeah, I don't think that is. I mean, do you know, Ron, in the reopening plans?
I don't. Are they? Is the individual? I wonder if the individual is a member of a bargaining unit, and if they are, they should probably have that discussion with them.
Yeah, I think that is the case. If they are an employee with one of the collective bargaining units, that's the way to process that. Although, again, what we've done in the county is identified individuals, self-identification, those who are vulnerable. They're being given appropriate, reasonable accommodation to return to work, perhaps not in the office, but outside of the office. June, is an outdoor wedding at a venue with less than 50 people low, medium, or high risk? So an outdoor wedding at a venue with less than 50 people is permitted, right, Ron?
That's my understanding. They haven't identified or they haven't specifically spoken of weddings, but they've spoken of social gatherings, and those have to be 50 or less. However, what you have to be concerned with is what is traditionally the activities of a wedding and how people congregate. They all come at the same time. They all usually leave at the same time. The same rules would apply to restaurants that the SLA puts out, specific to caterers. So that traditional walking around with food served, hors d'oeuvres, and people holding drinks without masks would not be permitted. They would only be able to sit at the table unmasked. There would be no dancing. So it would not be what you normally know a wedding to be. It would still have to be restricted to all those guidelines. And it may not be you if you're doing it at your home, but your vendors, you're putting your vendors in a certain position that could jeopardize any license they have if they are employed, and then the guidance is not followed.
Thank you.
It's a very touchy subject.
It is, and understandably so. Lori is asking if the travel forms that are required, are they required for travel by car? The answer is yes. No matter where or how you travel from those 31 states or to one of those 31 states and return, you are still required to complete the form. And I remind you, again, not Dutchess County, but the state of New York is assessing a fine of $2,000 for failure to comply with that expectation. Of course, once you complete that form, you're likely acknowledging that you traveled to one of those 31 states, which then would require that 14-day quarantine. Felicia is asking, how concerned should we be about college students from throughout the county returning here. Anil, do you want to talk a little bit about that? Now, first, remember last week we reminded folks that several of our colleges are functioning only on virtual. Several of our colleges are really locking down, in essence. I think Vassar, for instance, you get tested regularly. Anil, how concerned should people be about just college students returning?
If you consider that, again, the geographic spread of where the college students are coming from, it is a very valid concern, because again, if they're coming in from areas where there's quite a bit of transmission, such as in the South and the West or Midwest, and they're coming to Dutchess County, then I think the colleges have to pay special attention on how are they going to quarantine once they get on campus. If they become symptomatic, what are the ways that individuals can be segregated or cohorted from the rest of the population, so that college campuses do not become a hotbed for disease transmission.
Thank you for that. Emily is asking if can makeup artists work yet in phase 4? As we said just a moment ago, not yet, although we think that under a controlled environment that should be absolutely approved, but it is not yet. Heather, when will a bar be able to operate without serving food? Again, that is up to the state. I will tell you, and Ron, you can jump in and reinforce it or correct me if you feel that you want to. Our goal here in the county is to enforce the social gathering limits, to minimize the group setting. We will engage with businesses to kind of hold to that expectation. We don't really have the resources to check if people are serving peanuts or popcorn or potato chips, although the expectation is that you serve something that's similar to what's been sort of approved with your state liquor license, keeping in mind that State Liquor Authority can suspend that license. But again, the expectation at the end of the day is to limit the gatherings. That's the biggest concern. Ron, did I say that correctly?
That's exactly right. And we don't have it. The state doesn't have that manpower. While people may be sending pictures, taking pictures, and sending them or filing complaints, there are misperceptions, and we understand that. We usually contact the establishment, and they're usually compliant. We've only had one instance where they weren't, but it is to contain the virus, and there's quite a difference between a regular restaurant and a bar and a restaurant, and a place where you would get a lot of college kids gathering and standing primarily and drinking.
Right, and that's what we're really focused on. And again, I think it's important. I mean, I understand the desire to try to come up with ways to get a desired outcome, but the outcome is what's important, and that's what we're asking, right? Wear the face coverings, wash and stay clean, engage in the social distancing, and keep groups small. And if you do that, the disease won't be transmitted. And that's the important thing. It's not whether or not you're eating chicken fingers or nachos and salsa. It's about trying to limit the transmission of the disease. And so far, we've had businesses that are complying. We're grateful for that. Merrill is asking, any changes expected for the moratorium on evictions? We expect that moratorium will likely be extended, but it is not yet. So just keep in mind on evictions, we expect that moratorium will be extended a little bit longer. Jason asks, is there a website to find out what swim beaches are open and when they reach capacity? The short answer is every municipality manages that information differently. So if you go online, you'd have to visit your municipality's information. There is not a central location for that. Dr. V, Todd asks, when is it safe to travel to airports and take flights? Why don't you give a little bit of what's risk assessment for air travel, and what precautions should people take before getting on a plane?
That's a pretty complicated answer. I would really give great thought as you're planning a trip. One of the first things you must consider is where the location and what the community transmission rates are in the location that you plan to travel to. if I was going on a trip, I would try to find a mode where I would not be packed together with other individuals. Airline travel, because of you're basically cohorting people very close together, the risks are higher. Of course, airlines can put empty seats between people. There are other things like wearing masks while in flight. All of those can have beneficial effects. But again, as Marc, that you stressed, social distancing or separating and physical distancing is one of the most important things you could do to keep safe. And it's hard for me to find a good way of doing that in flight unless you have very few people on that plane.
So you're hesitant to encourage air travel?
At this time, given the situation in the other states, I would be very cautious.
So along those same lines,
Marc?
Yeah, Ron, go ahead.
Can I just offer something that may sound a little silly, but I've been recommending this to many people. There are many people that I know have not been to all the amazing sites and resources that we have in Dutchess County or in our region. Whether it's a park or a trail or a historic site, we are chock full of just the most amazing and diverse places to go in our region. And I would really encourage people to rediscover. I'm not trying to be, promote ourselves, but rediscover Dutchess, rediscover our region. And you can go on DutchessTourism.com and you could see all the things that we have to offer. Stay at home, enjoy this region. I guarantee you, this COVID, we will get by this eventually. But I bet you can't hit all the most amazing places that we have in our region during that time. So there's plenty to do here. Take advantage of it. Spend less money and see things that you've never seen before, and be safe.
That's a wonderful suggestion, Ron.
That is the Assistant County Executive for Economic Development. If you couldn't tell, I can't agree more, and I won't add to it at this point. But to say absolutely bravo, and we agree. If an individual is an essential worker that's on vacation in one of those 31 states, are they exempted from the quarantine? What is this language is a little bit screwy as well. It's a little bit confusing. Ron or Anil, what is the expectation if you're a deemed essential worker? Keeping in mind that what is deemed essential is really more about the employer and whether or not the individual's been deemed essential. What's the expectation on travel for an essential worker? So they're not going there for essential purposes. They're going on vacation but come back. Anyone?
Ron, you want to? I will. I will give one part of that answer, which is when they return, and if they are deemed an essential worker, it is very important that the employer find a way of having that employee come to work and be in an environment where exposures do not occur. So certain accommodations can be made, meaning when they come in, the physical plant do not have a lot of people. Or when they're in the job setting, they're wearing a mask. They don't travel anywhere else except from home to work. And so those are some of the measures that can be taken to make sure that an essential employee is still able to provide services that he or she has to give that job site, but do it in a way where transmission does not occur.
Yeah, there are exemptions for individuals depending on the amount of time they're staying in New York or where they went. If you go on coronavirus.health.ny.gov, it shows the precautionary quarantine requirements as well as those exemptions for essential workers. I do know that in the first 24 hours you are required to get a test. And you do have to, as the doctor said, there are certain things that you will have to adhere to. But again, coronavirus.health.ny.gov, all that is spelled out very clearly.
Thanks. Mary's asking as it relates to school reopening plans, and I want to commend the Department of Behavioral and Community Health. We've been meeting with our school administration really for a week now. In fact, every day this week so far, both public and private schools to assist in the reopening, in development of the reopening plans. I'll say that there's an earnest effort to reconnect students with teachers. The expectation and the hope among all is that there be a return to sort of physical presence. But Dr. Wythian, Mary is asking if all students are expected to be tested. And I think the short answer is no, but what light do you want to shed on some of the school planning? I know that your staff's been very engaged in that.
Part of it is again, I don't think it's feasible to test all students. And when you consider that this population tends to be a population that has very little symptomatic disease, what criteria do you put in place to make sure testing occurs? So I think more than anything, the important things that we have to consider is the physical layout of the classroom, the carrying capacity of a particular classroom. Can some of these educational opportunities take place outside? If someone is symptomatic, how do we take them out of that population? And how does education continue in a remote fashion? So these are all of the areas that we're exploring, but testing all the students, I think logistically, it would be very difficult.
But I mean, in fairness, right, a school district could suggest that as part of their reopening plan, but it is unlikely they would and impractical.
Absolutely. We would not be against that. We're just saying that the practicality of it.
Right. So I think that what you'll see is a lot of precautionary steps that take place and limitations on sort of the congregate settings that occur in schools. But the goal, again, the state starts from the presumption or the hope that we will reestablish in-person education and that there'll be that teacher-student relationship, but again, with certain precautions. And that's what we're trying to help school districts navigate. Angel asked if Dutchess BOCES is going to open with schools in September, and I believe that Dutchess BOCES will provide the support based on whatever the district is providing. So we'll get some clarification and provide that. Anil, you don't know that answer, I assume. Dutchess BOCES, do we have any?
I think again, your answer with regard to what the other school districts are doing and they would follow suit is the current understanding that I have.
Okay, because again, Dutchess BOCES provides centralized service to every district in the county. So if a district is providing a service where Dutchess BOCES would have to be a party to that, they would have reached agreement. So it'll likely mirror what your district is doing, but again, we'll get some more clarification, and those plans will be developed by the end of this week, so we'll have a little bit more understanding as to what they are and are not doing. Kim asks, Ron, when can veterinarians open so pet parents can go in with their pets? That is a very detailed, specific question. I think that veterinarians are open, and you can go in with your pet, no? You have to drop off out front?
I did not know that they were restricted. I guess they're talking about wanting to be in the room with the pet during the procedure. That I don't know the answer to, but they are open for business.
And we'll find out. But currently, I think you're right, actually. When I brought my dog into the vet, I did meet the vet outside, and the dog went in and I didn't, but there wasn't a procedure, so it didn't worry me so much. That said, I think currently that is the limitation, and we'll find out when and if that is going to change. A slightly different medical question. Julia is asking, can medical buildings refuse service if you have a mask exemption? So you're not able to tolerate a mask. Can a medical building refuse access? I think the short answer is sort of. I mean, Ron or Anil, I think the expectation is that if you have some limitation, you need to call ahead, work that out with your physician, your doctor, or the specialist, and they need to come up with an accommodation. But I do think that they can refuse to let you just walk in without a mask. Is that about right, Ron or Anil?
That's a good assessment. Yep. Every institution or facility can have internal protocols that dictate how care is delivered. with that being said, your suggestion that calling ahead can solve much of the problems because accommodations can be made.
And it would be expected that there would be a reasonable accommodation. Ron, did you want to add to that?
No, I agree 100%.
Okay, great. So I want to get through a couple more bullets, and then we'll get on with our day. I appreciate you all hanging in there. Jeff asked, and I thought this would be a good transition. Jeff asked, what state funding will be provided to support businesses and their employees? Now, a couple things that we want you to be aware. Dutchess County, Ron, the IDA is still administering a micro loan program?
That's correct. It's done through Community Capital New York, CCNY, and there's actually a number of different programs that are available.
Why don't you run through them quickly?
The federal government. Yeah, the SBA, Small Business Administration, has a fund. Central Hudson has a fund with local banks that is available to COVID-affected businesses. Empire State Development in New York State has a loan fund, and so does our local IDA. It all depends on what your business is, how you were affected. Feel free to email me at ron@thinkdutchess.com, and I'll be happy to find out very specifically what your needs are and see what resources we can direct towards you.
Terrific. And so one of the things that will be available soon for a select number of businesses based on federal guidance is the county will be launching a micro grant program through our Housing Urban Development Aid. Details are still being fleshed out, but you'll look for that, and Ron can be a good point of contact once that's available. But I thought this would be also a good opportunity just to remind folks that right now Congress, the federal government, not the state government, Congress has been in the midst of debating the next coronavirus or COVID-19 response package. You likely know that the House of Representatives, and we're grateful to Congressman Maloney and Delgado, the House of Representatives adopted what's called the HEROES Act. It is an exceptional amount of resources made available to every entity, level of government, and organization that may have been impacted by the closure and COVID and the pandemic. That is the House of Representatives bill. The Senate, U.S. Senate, is starting from a point that is much stingier, frankly. And so if you're watching on Facebook, we pull up our members of Congress and those who are U.S. senators. The Senate bill, and admit to you, Senator McConnell, the majority leader, has started from a point where this legislation, the Senate's position is no state and local government aid, and then a series of other resources that they would like to make available. It is not sufficient. And I offer this to my colleagues in the U.S. Congress. This is not a time to play political games. Frankly, this is not a partisan question. I can tell you, as a Republican, I have run and we have run a county government as efficiently and effectively as possible. We have staff and public health employees who have been doing an enormous amount of work, and we have seen thousands of people impacted by the disease. And as we all know, 153 individuals have died in this county because of the disease. This is not a time to play some sort of partisan game, and it is cravenly political to suggest that states and counties sort of fend for ourselves. We have been the front line of this response from day one. Like most emergencies, with all due respect, it isn't Congress that's responding, and it isn't the federal government that's responding, and secondarily, it isn't even state governments that respond initially. Of course, we all partner in this, but it's local government, counties, towns, villages, and cities that have been responding from day one. The very first case was Pat Ryan, the Ulster County executive, calling me to tell me that their first positive case occurred in Dutchess, and from that second, our response efforts, our responders have been working on the ground. You met a couple of them. You've met a couple of them throughout these town hall meetings. We're the ones that worked with healthcare providers to prop up testing sites. We're the ones who manage the 911 system and respond to calls. We're the ones that operate the small business assistance. We're the ones that are agitating, aggravating, and irritating state and federal governments to respond. I just would say that with massive loss of revenue and massive burdens of new cost and the loss of real lives across this country, state and local governments need your help. And the federal government has never willfully abandoned its local government partners in the response to an emergency, and don't let this be the first time. And so we're encouraging you to reach out to your members of Congress. If you think that aid to small business is necessary, speak up. If you think another stimulus check to provide direct assistance to individuals is necessary, speak up. And if you would join us in articulating a message that we need the help too, in order to sustain those services you expect, in order to ensure county employees, local employees are still doing the work that you expect of them, and in order to continue in that frontline response, we need the Congress's help. So the majority in the House voted on something that we know isn't going to become law, but they've made clear their commitment, perhaps knowing that the Senate was going to start from a different perspective. So we need you all to come together now. We need you to work across the two houses. We need you to work across party lines to get the job done. We are doing our job. So Senator McConnell and all of my colleagues in the federal government, you need to do your job too. And your job is not to leave the first-line responders, the front-line responders in state and local governments out on a limb without that aid and without that support. And it's critically important. And in these next several days, it's going to be a topic of great conversation. To that point, next week on the 29th, we're going to be live again. We're going to be inviting a couple other folks from Department of Behavioral and Community Health. Allie Smith, why don't we, I'm going to go to you just for one more reference. I think we're going to invite Kathy Tempmeyer and Andrew Evans. Kathy has been steering our response from the administrative level, Deputy Commissioner, Assistant Deputy Commissioner at the Department of Behavioral and Community Health. And Andrew Evans is who? Who is Andrew Evans, Allie Smith?
Andrew. Andrew is our coordinator of communicable disease. He's basically my other half in this entire effort.
And I would venture to guess that you think very highly of the folks you work with. Why don't you remind people just a few of the tasks that you interact with, and then I'm going to close with one reference to other county employees who deserve some recognition. But why don't you remind people what happens, what does the epidemiologist do in the midst of all of these moving parts?
We just try to keep our fingers on all of it. So from the time that we're reported a positive case through the time that that person would be considered resolved of their symptoms, taking care of their contacts that may have been exposed, and hopefully mitigating any other exposures that happen to hopefully stymie some of the spread of this disease.
Well, we thank you for all that you do. We're thankful for all of the staff at the Department of Behavioral and Community Health. I say half kiddingly to the individual who wanted to make sure there were other people than me involved in this in these town halls. We all have been learning from one another, and we all play a role. And I'm grateful for the team we have here in Dutchess County. I think we have among the best in the state. Take that to my colleagues in other counties. I think we do have the very best in the state of New York. I'm not only saying that because it's part of the job, but because I've seen the work that many of you have done. So Allie Smith, thank you. Dr. Wythian, thank you. Thanks to the staff there. I want to recognize another group of people, our pretrial, probation, and parole officers in county government, our pretrial and probation officers. July 19th to the 25th is pretrial, probation, and parole supervision week, which is it's a mouthful, but most importantly, it is a moment in time where, as a nation, we recognize the men and women of probation and parole. I think it's important at this moment as well to recognize that here in Dutchess County, the faces you see represent a number of staff who oversee and supervise approximately 2,800 individuals who are on probation in Dutchess County last year. This is another face of law enforcement. And despite all the challenges, the folks at the probation department, community probation officers and those who are serving in county government in this regard really put their lives on the line every day to provide for public safety. But as importantly, they're not only enforcement, if you will, they're the connection. A lot of individuals who are either pretrial or have come out of jail or prison, jail in this case, and obviously state and federal prisons. These are the individuals who sort of act as counselors and assistants. In fact, we were told a story the other day that one of our probation officers checked in with one of the individuals that they supervise. And we've been doing this virtually. We've been doing it telephonically. But they actually said they missed seeing their probation officer. They missed that interaction. because the relationship is critically important. And if we're going to confront issues in law enforcement, it's that relationship. It's a healthy respect for individuals who are trying to get back on their feet and restore their lives. It's a healthy respect for those men and women who sacrifice, and it's an acknowledgement that we always have to strive to do better. So thank you for the work that all of you do. We will see you 1 week from now, 3 p.m. on Wednesday, July 29th. In the meantime, be safe, stay healthy, and please be kind to each other.